Rheumatoid arthritis ocular manifestation. It is one of the most important questions asked in the exams. 25% of people with rheumatoid arthritis have eye problem. The most common one is keratoconjunctivitis sicca. If the patient with rheumatoid arthritis have redness, then the most possible cause is episcleritis. If redness is with pain, then it is scleritis. Other conditions are corneal ulceration. Other than the disease ocular manifestation, there are iatrogenic ocular manifestation as well. There are steroid-induced cataracts and chlorine retinopathy. There is an important question regarding differences between scleritis and episcleritis. Scleritis is a severe condition. It is more painful with more discomfort. On the other hand, episcleritis is milder. There is no pain, however, patients do experience some discomfort.